The aim of this article is to understand and articulate the lived experience and the cooperative organization of cystic fibrosis care as it is currently structured across clinic and home, the factors which shape current care practice, and the beliefs of patients and healthcare professionals underpin these practices. CF is the most common fatal genetic condition amongst Northern Europeans. It is characterized by an inability to clear stick mucus from airways. To maintain health, patients need to keep a daily regimen of self care and go to see a doctor regularly. As treatment has become more complex, patients struggle with self management, so it is important for patients and doctors to collaborate. In this way, increasing the proportion of CF care undertaken outside of clinics may offer significant advantages. In recent years, people get interested in potential of home-based health monitoring devices and applications to facilitate long-term NCF. Based on this technology, patients can share their information to clinic teams to help doctors to make final decisions, but the information exchange can be compromised as patients and doctors expect different forms of acknowledgement.
In order to conduct the study, the researchers adopted the grounded theory, which is an inductive research method in which theoretical concepts are derived from the data through an ongoing iterative process of data collection and analysis. It provides a structured process of analysis that has been widely used in qualitative healthcare research as a way of understanding lived experiences. They observed 10 consultations and saw the challenges of patients as well as observed the journey throughout the clinic. They also conducted 18 interviews in which included questions about their overall experience of living with cystic fibrosis and how it affected their daily life, their experiences of the clinic and exacerbations, their thoughts on technology and how it might use to change CF care, and their feelings about the data which such technologies might generate and how they would engage with it. They found that the majority of individuals struggled with their CF management and they utilized technologies ranging from calendars to glucose monitors to health monitoring apps. Regardless of how they use the technology, they find it to be incredibly helpful and impactful.
In the article about potential technology for cystic fibrosis patients, patients were excited about the possibility of having wearable technology implemented in the future of cystic fibrosis care. Patients discussed different ideas on how to implement technology and separated the ideas into three groups. The first group was data augmentation of existing clinics. The second group was remote triage, and the third group was remote clinics. Data augmentation of existing clinics was an idea to improve clinical decision making using the data that was gathered, making a more holistic approach for an individual. The remote triage idea focused on the video call schedule with a cystic fibrosis specialist nurse before appointments to determine whether they should come in at all or could postpone their appointment safely. The remote clinics idea focused on making the routine appointments through video calls.
Based on these three categories, it was commonly reported that it would increase operational flexibility and efficiency while also saving physicians from expending any unnecessary resources. As discussed in class, due to all of these benefits, it would be beneficial for entrepreneurs to pitch their ideas, but some issues they would need to consider include data overload, which may affect how well the physician interprets the mass amount of data. Also, CF patients already have to deal with medication, diet, and therapy, let alone the pressures of consistently self-monitoring that is essential to the care they will receive from a physician. Additionally, CF patients may identify with CF too much, which will discourage them from continuing to use the monitor. Overall, it is important to note that when developing this device, CF patients are more willing to deal with the additional efforts needed to be put in if the overall burden is reduced.
With the advancement in technology, it becomes more and more possible for healthcare providers to offer virtual care options. It makes it easier for those who aren't able to see a provider in person. Patients don't have to take too much time out of their way to perform simple tasks that don't necessarily have to be done face-to-face. Also, telehealth can help cut down the long wait that many patients have to go through. However, telehealth does not exist in order to replace one-on-one doctor-patient consultations. In-person consultations are still important, especially for those who have serious health issues or for those who are feeling some symptoms for an unknown reason. For these, it is important to have an in-person consultation because providers can give a more comprehensive care to the patients. Virtual care options should mainly be used after already seeing a provider in person. As virtual care options become more common, it also comes with questions that has to do with safety and patient information security. Accumulating large data from many patients might make it harder to maintain security, which is especially important because it is handling private patient data.